Have you seen a CBC on your recent blood work and are wondering what that stands for? A complete blood count, also known as a CBC, is a basic part of annual blood tests. Hi, I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician, and my goal is to empower you on understanding basic diseases and medical concepts, so let's begin. Your primary care doctor or internist will generally order blood work on a routine basis. That can be once a year or less depending on how healthy you are, but if you have diseases like diabetes and high blood pressure, you may be getting that checked once or more often per year. A CBC, also known as a complete blood count, gives you information on your blood cells. The three major blood cells that we are concerned with when we look at the CBC are the white blood cells, the red blood cells, and the platelets. Now, your white blood cells are basically the cells that help you fight infection, but that's not the only thing that they are responsible for. They also take care of the allergic response, including many other reactions. Now, white blood cells can be lowered or raised in certain disease states, including infection, fighting cancer, and drugs can also impact that. Stress can also raise your white blood cells, such as trauma, and then we've seen white blood cells be raised with certain drug use, such as marijuana, and then also in seizures. Now, your red blood cells are basically the cells that carry oxygen to the rest of your tissues, but they don't do it alone. There is a molecule called hemoglobin, known as HGB for short, which is also on the CBC, that carries the actual oxygen. That molecule is responsible for picking up the oxygen when your red blood cells are in the lungs. When your red blood cells travel to the capillaries, or the smallest vessels of the body in your lungs, they pick up the oxygen available to them, they hold on to that oxygen, and then they unload that oxygen at your various organs and tissues. And those hemoglobin molecules that are in your red blood cells are responsible for maintaining the oxygen levels. Now, of course, oxygenation of your blood and your organs are due to a number of processes, but the hemoglobin is a key player. Now, the HGB will be represented on your CBC, including whether it is or without a differential. The hemoglobin can be low in times of deficiencies, such as, for example, anemia. And it can also be high in a very small set of cases, such as polycythemia. Think of iron deficiency. The hemoglobin can also be affected by B12 vitamins and folate and other minerals as well. The hemoglobin can also be impacted by genetics, so think of sickle cell or thalassaemic genetic traits that can be inherited. And then finally, there are certain drugs that can also impact your hemoglobin. And these drugs that we are usually referring to include prescriptions that the doctors are giving you. Finally, white blood cells and red blood cells are accompanied by platelets. Now, your platelets are cells that help you clot. So think of that cut and that bruise. With the platelets, they are responsible for preventing an endless bruising event or an endless bleeding event. When your platelets get too low, your risk for bleeding endlessly with very thin blood is incredibly high. Now, platelets can be high or low depending on a number of reasons. They can be high in times of like leukemia and certain other blood cell disorders, but they are often low in the hospital setting due to a number of things such as sepsis, vitamin deficiencies, and drugs. Alcohol can also have an impact on platelet counts by causing cirrhosis, and the cirrhosis is when you often see low platelet counts. And I hope this is a good overview of a CBC. If you have any questions, please post below. Until next time.